Good. So cardiovascular systems means heart. Cardiovascular, you see, cardiovascular system made by heart and great arteries means vascular system. Heart with vascular artery and vein. So I said the anatomy and physiology first. Anatomy, the structure of the organ or body. Physiology, this is the how body work, the function basically. And biochemistry means the chemical reaction occur inside the body tissue, especially metabolism or other chemical reaction, and finally produce the energy as a ATP. Biochemistry, anatomy, physiology, biochemistry. Then disease formation in the body. How disease formation? This is discussed in the pathology. And pathology, disease formation. When disease formation, we have to give them treatment, and this is medicine. But some of the disease not cure by medicine. That times we has to cut and remove. This is surgery, right? So all of the part of this some health science. So heart anatomy, they said heart and the heart wall layers. So heart is located in the left side of the mediastinum. First of all, if I say heart is located on the left side, everybody know that. This location in the thorax is called mediastinum. So the location of the heart is mediastinum. So here I said mediastinum, and the heart consists of the three layers. The most inner layer is called endometrium, then in between myometrium, and outer layer is called epicardium. So you see, this is the layer inside endometrium. So this layer folding and make different structure inside the heart endometrium, like this is the, you see, valves, or there are so many interior. This interior made by inner layer or endometrium. In between the layer is called muscle layer, myocardium. So heart muscle is just very specialized. Why they are specialized? They are specialized because your heart not your control. They are work according to them. It is involuntary muscle. So if you say, my heart, please stop, please take rest, it does not work. They work non-stop. But I'm saying the heart muscle is a specialized tissue because they are involuntary. They can produce the impulses, means heartbeat. So what we know from today, we know heart muscle or myocardium is a very specialized tissue. Why they are specialized? Because they can produce the action potential. They can produce to contraction and relaxation. And contraction and relaxation is the systole and diastole. So because of the heart contraction and relaxation, blood is pumping all over the body. So hope you are agree with me to say the heart muscle or myocardium is a specialized tissue. So here, specialized tissue, and the outer layer is called epicardium, most outer layer, epicardium. So again, or on the other hand, I can say the outer layer also contain three different layers. One is called fibrous layer, pericardium layer, right? This is the outermost layer. So go here. So we are just talking about the pericardial sac. Pericardial sac. So pericardial sac here, the it is encases or protect the heart from trauma or infection. So outermost layer is pericardial layer, outermost layer, and this layer again has a two distinguishing layer. One is called parietal pericardium and visceral pericardium. So first of all, here we say the three layers. In interior the endocardium, then myocardium, outer layer is the pericardium. But now we are going to focus in the outer layer only. In the heart is covered by a protection. This is called pericardial sac. This pericardial sac has a two layers. So we are talking about the outermost layer, right? Cardiac sac. And cardiac sac has a two different layer. One layer has to connected to the heart. This is called viscera, because heart is an organ, kidney is an organ, liver is an organ, but commonly it is called viscera. Viscera, right? So viscera only. Like you have a different name, I have a different name, she has a or he has a different name, but all are human. All we are human. So heart, kidney, lungs, liver, different particular organ, but common name viscera. So the this sac outer layer has a two layer, two distinguishing layer. One layer attached to the viscera and other layer attached to the most outside protect the body. So like imagine you are wearing two shirts. You are wearing a t-shirt and another shirt you wear over the t-shirt. So in between there are room. The t-shirt touch your body or skin and the shirt is over the t-shirt. They are the outer protection. So the shirt and t-shirt in between there's some room. This is the sac. Has a two layers. One layer attached to the heart, another layer is the outer, and in between there's some room area. So this said parietal pericardium and visceral pericardium. Visceral pericardium is a thin or inner layer. I mean, I said the what is the t-shirt attached to the our skin, and the shirt is over the t-shirt is the parietal pericardium. So it is the fibrous outer membrane attached to the anterior to the lower half of the sternum. So pericardial sac means in between, between the parietal and visceral layer. It holds 5 to 20 ml pericardial fluid. So in these two layers, some fluid, and this fluid protect your heart from any kind of pressure or injuries. They work as a shock absorber. Okay, shock absorber. Now go here. There are 4 chambers in the heart. So okay, so heart has a 4 chambers. Everybody know that. Heart has a 4 chambers. 2 right atria and 2 left ventricle. So this is the right atria, right ventricle, and left atria, left ventricle. So the heart has a 4 chambers. One, out of 4 chamber, there are 2 atria and 2 ventricles, right? If I divided the heart in right and left, means the right side and left side, right heart and left heart. The right heart contains right atria, right ventricle. Left heart contains left atria, left ventricle. So if I divided the heart left and right, this is something is important because right side, I mean right atria and right ventricle contain deoxygenated blood, whereas the left heart, I mean left atria or left ventricle contained oxygenated blood. And 2 terminology sometimes we use, right? One is called left heart failure or right heart failure. So if I talk the right heart failure, maybe the problem start from right ventricle, and right heart failure lead to develop left heart failure. Means the problem from mostly left ventricle. So right heart failure lead to left heart failure, and left heart failure lead to, if not treated, both side heart failure or congested heart failure. So if you ask me which heart failure is most common, left or right, most common left ventricle heart failure or left side heart failure. If you ask me why, because workload is more in the left side rather than right side, and the thickness of the wall of the ventricle is more in the left side. Thickness of the wall. Why thickness is more? Because the workload in left heart is more. Left ventricle is pumping and blood is grow all over the heart. But left ventricle is pump, blood is only go to the lungs. So different, just go back a little bit. So blood come from upper extremity. Upper extremity means head, neck, and 2 limbs. Then blood go through the right atria. From the right atria, there is one opening in between right atria and right ventricle. This is the opening or valve. It is go from finally, I said the superior vena cava, this one, blood is collected from upper extremity, head and neck area. And the lower, I mean, 2 legs, perineum, abdomen, thorax, if blood is drained into, from blood drain from lower area to the right atrium. So from upper extremity or from lower extremity, both area drain finally into the right atrium. So you can see the inferior vena cava behind of right ventricle, but they opening inside the atrium, right atrium. superior vena cava, inferior vena cava, both drain inside the right atrium. And blood then during the contraction of right atria, valve is open up and blood go inside the right ventricle. Always after the contraction, the relaxation is there. Contraction is called systole and relax is called diastole. So during the contraction, valve is pressurized to the down and blood should go here, right ventricle, and then when right ventricle contraction, blood go through this pulmonary arteries, right? And blood is go through the lungs is there, where deoxygenated blood get oxygenated, or you can say the oxygen or carbon dioxide exchanging inside the lungs. And oxygenated blood come from lungs to the left atria through the pulmonary vein. So from the left atria, when contraction, there is a one valve again, means door or opening, blood is come left ventricle, and from the left ventricle during the contraction, blood is go through the arch of aorta and blood is distributed to the upper portion, I mean head, neck, upper extremities, and also go through the lower area, through the thoracic aorta or abdominal aorta, through abdomen, thorax, and also the lower extremities and perineum. So here important things I want to clear it up. So right ventricle workload is less than the left ventricle. So left ventricle wall is thicker, but their wall is thin. So who work more? Like a person who every day go to the gym and make some muscular body, like this is his profession, who go to the gym for muscular. So the person who want to make the muscle, they need more protein because they are trying to increase the muscle mass. So if the organ work more, they need more oxygen, because the oxygen is the food of the heart, right? So, you know, like you work, you earn the money, then you go back and you serve for your little kids, right? But I said, you earn the money, you buy the food and you bring it to home and you feed them. But what about you? You also eat, right? So you also help yourself. You also eat, I said. So heart pump the blood whole over the body, but same time heart need the blood supply for themselves. So I said, if the heart does not get enough blood supply for itself, the tissue is go under necrosis. Necrosis means less blood supply. And tissue necrosis when occur, the wall is undergo the necrosis process. Easy way you can say tear up of the tissue, and it is called ischemia. Ischemia. It is called myocardial ischemia. The other name of the heart is called myocardium, right? The inner layer. So myocardial infarction. But I said the in any kind of path, first definitely it start first angina, then angina pectoris. If angina pectoris lead to the myocardial infarction, and myocardial infarction, if untreated, develop heart failure. This is one way. But I was saying the heart failure is most common to the left ventricle because the thickness of left ventricle is more, workload is the more, so they need more blood supply. If the blood supply or any other pathology develop in the left ventricle, and left ventricle lead to the left heart failure. Or if problems start from right ventricle heart failure lead to the left ventricle heart failure, and both together causes the congestive heart failure, right? There are one small YouTube link on the below, so if you like, you can hear it or listen it. And we have to go next here. So there are 4 valves in the heart. There are 4 valves, they said. 2 is called 2 atrioventricular and 2 semilunar. So 2 atrioventricle. So this is the atria and this is the ventricle. So the valve in between atria and ventricle, this is called the atrioventricular. So 2 pairs is atrioventricular because this is one atria right, another is the left. So one is in between right atria and right ventricle, one in between left atria and left ventricle, right? So 2 pairs is called atrioventricular or AV valves, right? So the valve in between left right atria and right ventricle, they are tricuspid, and the valves in between left atria and left ventricle, this is called bicuspid. If you ask me why bi and why tri, because there are 3 curves in the structure of the valves. There are 3 curves, and here are there are 2 curves. All right, the 2 curves here, and so it is called bicuspid, and here are the tetra or 3 tricuspid. If NCLEX board asks where is the location of tricuspid valve in between right atria and right ventricle. Where's the bicuspid valve? Bicuspid valve in between the left atria and left ventricle, right? So now a question is related. So do you usually when heart is go to the contraction, usually the bicuspid and tricuspid valve is closed in the same time or open in the same time. So S heart sound, heart can produce 2 sound. One is S1, other is called S2. Okay, or lap or dub. S1 is produced during tricuspid and bicuspid valve closure. During the closing of bicuspid and tricuspid, S1 is produced. NCLEX asks this question. And when the S2, heart sound S2 produced during aortic or pulmonary valve closing. So easy to remember, S1 is produced during bicuspid and tricuspid. S1 by 2, tricuspid 3, 1, 2, 3. But S2 is produced during pulmonary or aortic valve closing. So aortic valve in between left ventricle and arch of aorta, and pulmonary valve in between right ventricle and pulmonary trunk. During the closing of these two valves, S2 produce. And these two, aortic and pulmonary valve, is semilunar valve. Two semilunar valve. One is the pulmonary and is the aortic. So next here, so here little bit talk about the how heart produce the impulses, right? Because at the beginning I told you heart is very specialized tissue. Why heart is specialized? Because they can able to produce the impulse. They can able to produce the electricity. Because of this electricity, heart can pump, right? So heart is specialized because heart contains a special tissue, and this is called SA node, SE node, right? Sinoatrial. Sinoatrial. So the location of this special node or tissue in the atria or in the sinus, so it is called sinoatrial or shortly called SA node. So SA node are able to produce the impulses or current, right? So this current has to produce with a regular rhythm, and the number of the impulses produced 60 to 100 beats per minute. So I said SA node is a special tissue. They can able to produce the impulses. So after they produce the impulse, this impulse is transmitted from SA node to AV node. From AV node, they passing through the his of bundle. Then his of bundle is divided by two. One is the left bundle branch, other is the right bundle branch. And this then they distributed all over the left atria and right, so left ventricle and right ventricle. This is name is called Purkinje fiber. On the other hand, I am saying, or you know that heart can contraction and relax. Why heart can contraction? Because of this mechanism, or because of this current or these impulses. Who can produce this impulse? SA node. Impulse produce SA node, but the impulse transmitted SA node to AV node, right? So SA node is a very specialized tissue. They are located in the atria, so it's called sinoatrial node. And then SA node, impulse from SA node go to the AV node. AV node means the node in between atria and ventricle, in between, so it's called atrioventricular node. This node then make a common pathway called hinge of bundle. This hinge of bundle then divided into the two branches. One is called left bundle branch, other is called right bundle branch. And then the impulse, what is produced as a node, they go SA node to AB node, then common pathway, then divided left bundle and right bundle, and finally go to the left and right heart, or right or left ventricle. So impulses go, and this ventricle contraction and relaxation. This bundle is called Purkinje fiber. So now talk about some disease. So if my heart does not able to produce the impulse, then I will be patient, right? So AV node can produce the impulse at regular rhythm and regular beat, and the normal be 60 to 100 beat. If my heart does not produce this amount per minute, less than 60, bradycardia. If my heart produces more than this, tachycardia, and patient has a palpitation, right? So not only the production or rhythm of the impulse, also it is important to carry the impulse. It's like my heart can produce the impulse, but impulse does not transmit it from SN node to AV node, or from AV node to the left or right bundle branch or Purkinje fiber, or delay means blockage, first degree heart block, second degree heart block, or third degree heart block, right? And same thing I said, bradycardia or tachycardia means more or less heartbeat, and both together is called arrhythmia. And if the heart does not produce regular heartbeat or any kind of delay or blockage, all of this is lead to produce the heart failure. So this is called the cardiac conduction system. So impulse is produced, then transmitted all over the heart, and this is called electricity conduction system. So if I ask you, heart is contraction relaxation, why? Because of impulse. Who can produce impulse? SN node. So SN node is a pacemaker. So if my heart does not produce enough SN node, you can give me a special device, and this is called pacemaker implantation. So this is the conductive system of the heart, or heart can produce the electricity because of action potential. Action potential produced because of electron. Electrons means potassium, sodium, right? So here now, so during when the SN node can produce the impulse, and heart is go contraction and relaxation, right? So the produce impulse and transmit it through the conductive system and contract from the heart. These different phases we can reflect, or we can express over the cardiac, graphical representation. So the graphical representation of cardiac impulse or cardiac impulse conduction system, it is called EKG or ECG, electrocardiogram. So EKG, if you ask me what is EKG, EKG is the cardiac, graphical representation of different event of the heart. I like to recap it. I said EKG is the graphical representation of the different event of the heart, right? So I like to little bit go back. So in here, we already discussed how impulse produce and how impulse transmitted. An impulse produce in a particular rate or has a particular beat per minute, and this normal beat is called, it is 60 to 100 beat. This 60 to 100 beat, and if the impulse produced from the S node, this is called normal sinus rhythm. This is called normal sinus rhythm. So this 60 to 100 beat is the normal heartbeat, easy way. Or I can say normal rhythm of the heart. And this, if anybody's heart beat is 60 to 100, it means the rhythm is regular. So if you say what are the normal means, the normals means there is a P wave after every QRS complex. So if I go in this picture, the one typical EKG has a different wave, like P wave, then QRS complex, and T wave, right? So this is a one event, complete event. So P, QRS complex, and T wave. Again, it is repeat. If you go in second picture, it would be repeat again, again repeat, again repeat. So when we see on a graphical representation, we can count the heartbeat. In my EKG class, I will explain more, but here I want to share with you a normal EKG strip or normal event has a P wave, QRS complex, and T wave. And as per I told, during the impulse or electricity produced, heart is contraction, and there are 4 chambers of the heart, right? So an NCLEX board usually asks when pre-wave is produced, right? So P wave is produced because activation of atria. This is the right atria, right ventricle, left atria, and left ventricle. When P wave is produced, P wave produced during the activation of atria. If you ask me what does it mean activation, or different way and say P wave is produced during the contraction of atrium or atria, then QRS complex is produced during activation of ventricle. So again, QRS complex is produced during the contraction of ventricle. If NCLEX board asks when P wave produced, during the activation of atria. When QRS complex produced, when the ventricle is contraction or activation of the ventricle, QRS complex. T wave is produced the recovery phase, means relaxation phase. Relaxation means recovery phase. So T wave represent the recovery phase. So this is the basic question sometime board asks, and if we know this is fine. And also sometimes board asks this is the P wave and this is the R. What are the interval in between this? So PR interval is equal to 0.1 to 0.20. So PR interval equal to 0.1 to 0.20. And QRS complex, it is actually called the length of PR interval or the length of QRS complex. The length of QRS complex is 0.06 to 0.12 second is the complex, right? So here I said that sometime NCLEX board asks the different question from EKG, but I will explain more in my EKG class. So now going the next, and here showing the continuation of the bundle of his and Purkinje fiber that I already explained before.